Thermoregulation and environmental physiology. These are the broad objectives of our lecture. So, we will be discussing about these objectives. So, what are the different environmental conditions that human beings live? You know that human being can be living in warm environments such as in warm climate conditions such as in deserts, in the countries like Middle East or in the countries close to the equator, countries like some part of India also, and then or maybe somebody will be living in an environment that is warm. For example, if somebody is working in the metal industry, or when they are continuously working close to some warm oven, or people can be living in cold environments, such as in the countries away from the equator, like in North Pole or South Pole, or even Europe and some people living in high mountains and all. They will be living in cold environments. And then the other condition is the high altitudes. You know, high mountains, we have discussed that under the respiratory physiology also. So, what are the ways of maintenance of body temperature? Human being is a homeothermic animal. Homeothermic means we keep our body temperature unchanged, nearly unchanged. That means, you know that some animal like amphibians and fishes and all, their body temperature changes with the changing environmental temperature. So when they are put into some hot environment, their body temperature will be increased, and without keeping in the same level. Or if they are put in a cold environment, their body temperature will be reduced. So that it is the underdeveloped stage. So that sometimes it will be harmful also, because when you are subjected to change in the body temperature, you don't feel that you don't feel that it can cause some harm in the body. So the body proteins can be denatured, some enzyme activities will be reduced, and finally even the animal can be killed even by destroying these cells. So the human body temperature is maintained around 37 degrees Celsius. And however, the suitable ambient temperature is slightly lower than the body temperature. You know that when you are living in a temperature around 30 or 25, you feel comfortable. And if the environmental temperature is also around 37, you find very uncomfortable, because usually the heat is generated in the body by metabolic activities. This heat should be dissipated to the environment, so that if you can't lose heat from the body, because if you have got the same temperature in the environment and the body also, the body heat will not be lost to the environment, so that there will be an accumulation of heat in the body, so that you find very uncomfortable. Mechanisms of thermoregulation. You know that heat generation occurs in the body due to metabolic activities of the body. The body cells will metabolize nutrients and then produce some heat. And then the additional heat will have to be lost from the body. So they will be dissipated to the environment by four ways. Conduction, convection, radiation and evaporation are the main ways. Conduction means heat will be traveling from the through a medium. So it's when you sit on a seat, you see that after some time the place where you were sitting get heated. Like that, because the heat is conducted through the body, skin to the seat. Like that, all the structures that you touch, they will come to that other whatever the thing through the skin. That is called the conduction. Convection means air molecules will come and touch the skin, and then these air molecules, when they get heated up, their temperature increases and they will move upwards, and then new air molecules will come and touch the skin, and these are called convection currents. Radiation means losing air from the skin, from the body, as heat waves. And then the other one is the evaporation, because when the body is wet, that means when the body has got sweat or water on the surface, these water molecules will get energy from the skin, they will absorb energy from the skin and they will get evaporated. So that is called the evaporation. What are the adaptations? Adaptations are, you need to minimize the heat loss in cold environments, and you have to increase the heat loss in warm environments, and you have to generate heat in the extreme cold environments. And in addition to that, there are some behavioral adaptations in addition to physiological adaptations. We will see what these things are. Physiological mechanisms are operative as autonomic reflexes. There are receptors in the skin for temperature perception. It's so that they are sensitive to cold and warm. There are cold and warm receptors. There is a thermosensitive area in the hypothalamus, and that detects the temperature in the blood. And there is an activation of autonomic nervous system. So it will cause vasoconstriction or vasodilatation by changing the sympathetic tone, and it causes stimulation of sweat glands. Those are sympathetic or the autonomic activities. There are some adaptations for the warm environments also. There are behavioral adaptations. These behavioral adaptations include moving to a shade. For example, if you are under the direct sunlight, so you usually automatically tend to move to a shade, and you wear a suitable cloth. You know that if it is sweating a lot, you will reduce your cloth, so you will remove the top button, and you might reduce the thick cloths, and the body posture also will be changed. You know that you don't want to keep the body tight, you will keep the limbs apart, and you tend to keep the body in a way that you lose most heat from the body. and you go for a cool drink or better ventilation, you might open the windows and you go near to a fan or air conditioner or whatever. Those are behavioral adaptations for warm environment. What are the physiological adaptations for warm environment? So they are there to increase the heat loss. So you can increase the heat loss by sweating. So when you sweat, you will lose temperature, you lose the heat by evaporation. And there will be dilatation of superficial blood vessels. So when the superficial blood vessels are dilated, the body surface will get warmer and it will facilitate the heat loss by conduction and convection also. So what are the behavioral adaptations for cold environment? Posture. You know that characteristic posture, you will try to keep all these arms flexed and then moving the flexing the body, the spine also. And the clothing, you will dress more clothes and sweaters or jackets or whatever these things, thick cloths, and moving closer to a warm place. If there are heaters or some area with less open, you will tend to go, that means you try to go into a house, and you might consume some hot drinks, coffee or whatever hot drinks. And some people tend to take alcohol or smoking. Alcohol does not increase the body temperature. What happens is alcohol will stimulate the sweating by dilating the cutaneous blood vessels. So when they dilate the cutaneous blood vessels, the people will feel sweating. Because of that, you will feel like the temperature is increased. Then the smoking, because when a warmer air enters into the body or the lungs, you will feel more warm feeling, and same time those stimulants, whatever you found in the smoke, also might cause some increase in the temperature. So what are the physiological adaptations for cold environment? You get sympathetic activation. The sympathetic activation will cause constriction of superficial blood vessels, so that it will cause the reduction in conduction and convection. So the heat will be preserved. The heat loss is when the heat loss is reduced. Shivering means the muscle contractions will be there, so that it will cause generation of heat by the skeletal muscle activity. And contraction of electropylorum in the skin, so that hair will be erected, so that it is more useful in animal. You might see in cats and dogs and various animals, is when they have got a lot of hair in the body, they will be erected, so that it will keep a air cushion under them and prevent the hair loss, prevent the heat loss, and so that it will reduce the convection. And secretion of thyroxine. So when the thyroxine is increased, it will increase the catabolism. So when the sympathetic activation is there, epinephrine secretion from the adrenal medulla also will be there. So that and sympathetic nerve endings also will secrete catecholamines. They all together will increase the heat production in the body. So what are the changes occur in the high altitudes? You know that we have discussed that in the under the respiratory physiology. It will cause, there are two main things happen in the high altitude. You know that there will be a hypoxia as well as there will be a it will be a cold environment. So that when there is a hypoxia, it will cause hyperventilation, and then if they keep on living there for a long time, the continuous chronic inhabitants in the high mountains, they will get changes in the chest also. We call that they get barrel chest, and they get polycythemia also because of increased erythropoietin secretion. We go to the temperature regulation. The body temperature of animals can be homeothermic or poikilothermic. Homeothermic means they maintain the body temperature in a narrow limit so that it is nearly constant. Examples are birds and mammals, including human being. And poikilothermic animals include they maintain a temperature within a larger range, so that they can fluctuate the temperature within larger range. Examples are reptiles, amphibians and fish. So that their body temperature increases when the environmental temperature increases, and when their body temperature decreases when the environmental temperature decreases. It's compared to the homeothermic animal, their temperature fluctuation is high. And some animal, they hibernate. That means they keep on, they go into sleep for a long time. So you know that like polar bears and all, they sleep for several months. During the cold winter season, they sleep for several months and then wake up after when the winter season ends. During this hibernation, their body temperature reduces, and then they maintain the body temperature high when they are awake. So the heat gain and heat loss happens in these ways. Heat gain is there by muscular exercise, assimilation of food, and increase in the basal metabolic rate. Radiation, when the environmental temperature is high, the body gets heat from the environment. And for example, when you go to sunlight, you get heat into the body. And depends on the endocrine functions and sympathetic activity also. Example, thyroxine and epinephrine both will increase the body temperature. Heat loss is by radiation, conduction, convection, vaporization, and through urine and feces also. Heat loss mechanisms. You can see again evaporation of sweat, radiation, conduction and convection, cutaneous vasodilatation, decrease in metabolism, and through the respiration also, because you know that during the expiration you lose hot air from the body. So that this diagram shows the evaporation. That means about 22% of the heat is lost from the evaporation through the radiation. The body gets heat as well as bodies, if you are in the sunlight or warmer place, the body gets heat from the environment. Or if you are in a cold and if the body environmental temperature is lower than the body, you lose some heat by the radiation. So the convection currents, the heat, the air waves, air flows, the hot air flows up, and that is the way of heat loss from the body through the convection currents. Conduction, for example, in this, the man sitting on a stool, so the stool is getting heat through the conduction. This is a sweat gland, and you produce mainly protein pre-sweat, and then when it is traveling in the ducts, some sodium and chloride, they will be absorbed. So this shows, you can see the hypothermia, this axis, the environmental temperature. During hypothermia, you can see the loss by evaporation will be reduced, this green one, and so the metabolic heat will be produced more because of the hypothermia, and there will be dry heat loss when the body temperature is slightly higher than, when it is higher than the environmental temperature. Radiation, convection and conduction will lead to, because anyway the body temperature will be maintained around 37, and when the environmental temperature is lower, body will lose, there will be dry heat loss. Radiation, conduction and convection, they will lead to lose the heat from the body. When it is 20 to 30, we call thermoneutral. That means there is a balanced state. When the body temperature, when the environmental temperature increases, maybe when it goes passing 37, evaporation loss will be increased because you will be sweating a lot, and heat uptake also will be there. That means environmental temperature will enter into the body. So the normal body temperature in humans, it's 37 degrees or 8.6 Fahrenheit. In the morning, the oral temperature will be around 36.7, and then during the daytime it will slightly increase because of the activities and the increase in the environmental temperature. So the temperature varies with the time of the day and the site of the body. There is a circadian rhythm. In the night, the body temperature will be reduced, and during the daytime or evening it will be high. The lowest at the 6 a.m. and highest at the evening, and the body temperature will be lower during the sleep than during the awake, and body temperature increase during activity. Usually the extremities are cooler, and it depends on the temperature of the environment. So that there is a temperature variation is seen in during the reproductive cycle of females. You know that during the luteal phase, the body temperature increases slightly. About 0.5 to 1 degree Celsius increase is there during the luteal phase. So the oral temperature is about 0.5 degrees Celsius lower than the rectal temperature. And it depends on some other factors such as taking food, mouth breathing or smoking. You know that if you take a food, especially if you take warmer or colder food, it will change the temperature in the mouth. And then if you are keeping on breathing through the mouth, then again the mouth temperature will decrease. And if you smoke, the mouth temperature will increase. The testicular temperature is maintained about 5 degrees Celsius or less than the core temperature. So the testicular temperature is about 32 degrees Celsius. And the body temperature increases during exercise. So it will go even up to 101 degree Fahrenheit, because it's 98.6 Fahrenheit degree Fahrenheit is the normal body temperature in Fahrenheit. So it will increase by about another 4 or 5 degrees Celsius. So the body temperature will decrease when you are exposed to a cold or 96 Fahrenheit temperature. Now we look at the temperature regulation as peripheral tissues. If you take the upper limb, you know that upper limb is a isolated organ that directed out from the body, and then it has got a arterial supply and a venous drainage. So that it has got some tissue also inside, bones, muscles and all, and then the artery brings blood and the vein drains the blood back. So it's you know that it's in a counter current mechanism. You know, at a counter current mechanism, when artery and vein, when there are two blood flows in opposite directions, the heat or whatever certain substances can be exchanged from one to the other. So here also it can happen. So they are at close proximity, and so when the blood in the artery is high, when they come, they will come, bring the blood to the distal end, and then from the veins blood will be drained back. So if you look at the because now you are losing the heat from the skin to the volume of the tissues inside, the skin surface area to the volume in the volume of tissues inside, that volume is less. I mean, the skin surface area is high relatively. If you compare with the trunk, it's so small volume amount of tissue is covered with a relatively larger surface area of the skin. So that the surface area to lose heat is high in the upper limbs or the lower limbs compared to the trunk. So that the venous blood will contain a lower temperature, because you are continuously losing heat from the skin. And then there is the heat exchange from the artery to vein, so that when the 37 degree Celsius temperature is there in the arterial blood, the venous blood contain little bit lesser temperature. For example, if you put in the hand into some cold environment, also cold bucket, again the blood will be cooled, and then when it goes back, there is an exchange of arterial blood to the venous blood, and then when this venous blood goes back to the trunk again, it will be heated up more than at the peripheries, so that it will be maintaining in such a situation. In a warm environment also, now the heat loss will be less. However, because of this countercurrent mechanism of arterial vein, the blood heat exchange will be there. So that if you take it mainly activates in a cold environment, so that you know that the peripheries or the fingers will have a lesser temperature than the trunk. That is why you know that these days when the temperature is measured by the this food cities and all these shops, the people they direct their thermometers to the forehead, or sometimes they do it to the hand also. But usually, even if you have got a fever, I don't think that it will give a recording. It will ever detect a person with fever, because always the temperature that you find in the hand is much lesser than the body. Usually it says about 2-3 degrees Celsius less. This is what happens in the skin. In cold environments, usually the arterial blood will be directed to the skin. In the normal situations, they will be traveling in arterioles, and then they will join to the capillaries, and then they will drain back to venules, and then they will be added to the veins. So in cold conditions, the cutaneous blood vessels will be constricted. So once they are constricted, what happens is, now you can see this, because of the sympathetic activity, these cutaneous blood vessels are constricted, so that the blood will bypass the cutaneous capillaries. So the blood directly from the arterioles, they will come to some smaller arterioles, and again to the smaller venules, and they go back. So that blood will shunt the skin. They will bypass the skin, and so that it will reduce the heat loss by doing so. So to show how to maintain the temperature in cold environments, you can see in the first or the left side this thing. So you can see these cutaneous blood vessels are constricted. There is a small blood flow or lesser blood flow. Sometimes you can say that it will be very low, so that the heat loss from the skin will be reduced. In a warmer environment, what happens is the cutaneous blood vessels will be dilated. You can see that they are dilated, and because of that, there will be more heat loss from the skin through the epidermis, and because of that, the vasodilation in the cutaneous blood vessels. How do we maintain the normal body temperature? So, heat is produced by the cellular metabolism. It happens throughout the life. So, human beings usually live in an environment in which the temperature is usually lower than the body temperature. And very rarely somebody might live in an environment with a higher temperature, but it is not compatible. It is not possible to live in such environment, and so that usually we live in a temperature that is lower than the body temperature. so that heat loss occurs from the body to the environment. And then so if you take the percentage of heat loss from the body to the environment, and you with the 4 different ways, or these ways that we have described earlier, if you take it at 21 degrees Celsius, you will lose about 70% heat by radiation. By evaporation, you will lose about 27%. By the respiration, you will lose about 2%, and by the urine and defecation, you will lose about 1%. Now you know that at 21 degrees Celsius it is a lower temperature, so that skin blood vessels will be slightly constricted. It is not a freezing temperature, but it is so that the sweating will be less. So that is why you lose large percentage with radiation and lesser with evaporation. And respiratory and urinary or fecal loss is continuously, that is somewhere, so that it does not change. And then if you take it to a much higher temperature, shall we say it's about maybe say if it is 30 degrees, the radiation loss, that percentage will be less, because now the body temperature to the environmental temperature, that gap is less, so that the radiation loss is less. But the evaporation loss will be increased because of the increased sweating. If you go to 0 degrees Celsius, the radiation will be, the percentage of by radiation will be increased, but the vaporization percentage will be low, because now you are not sweating. There will be some invisible water loss from the skin by the, by very small amount of water will be evaporated from the skin. So, but anyway, a large percentage of heat will be lost from the through the radiation. So then anyway, as this at 0 degrees Celsius, the body is trying to preserve heat, so that you can't control the respiratory loss, so that as a percentage it will be increased, not the heat loss will be decreased. Because of that, as a percentage the respiratory loss will be increased, and the radiation loss also will increase, but the vaporization, that contribution by this thing will be by vaporization will be reduced, but the total heat loss also will be reduced at 0 degree Celsius. So the different ways of maintaining the normal body temperature. So mainly you can minimize the heat loss, or you can increase the heat loss, or the heat gain can be increased, or heat gain can be minimized. Those are the 4 mechanisms that can operate, because the gain and it is a balance between the gain and loss. So either you can increase one and you can decrease the other, or you can decrease the other and increase the other. So the heat loss is minimized by cutaneous vasoconstriction. That means when the cutaneous blood vessels are constricted, the blood will bypass the skin, and then the heat loss will be minimized by adjusting the posture. That means if you reduce the surface area that touches the air, for example, if you flex the body with all the by adducting all the limbs, and you know that characteristic feature that you turn the body like C, and it will adjust the posture to minimize the heat loss by clothing. So it will reduce the it will cover the skin with cloths. If you cover the skin with cloths, sweaters and or jackets and whatever the cloths, it will reduce the heat loss. Horripilation is the next one. That is the skin, the cutaneous or the skin hair will be erected, and so that air will be trapped in them and the heat loss will be minimized. That is important for animal, because the human being has no body hair much, so that it's mainly in the animals. Heat loss can be increased by cutaneous vasodilatation, sweating, change in the posture. You know that when it is hot, you keep your limbs away and then let more air to touch the skin. Minimizing or selecting suitable clothes. You remove your jackets, you remove your long sleeve shirts, and then select much lighter clothes. Or sometimes you might move to water. You know that people go for bath, sea baths or water, to dive in the water to increase the heat loss. Panting. It's, you know that the dogs, animals like dogs, they put their tongue out and they sweat. They do the respiratory rate increase, so that by doing increased respiration they lose a lot of heat. So that is what they do when it is very warm. They put their tongue out also, and then they increase the respiratory rate. So heat gain is increased by shivering. You know that when you get fever, you might feel cold, but same time you get shivering. So there's some hormones such as thyroxine and epinephrine also. So that once they are increased, they will increase the metabolic rate. Heat gain is minimized by anorexia. Anorexia means the appetite will be reduced. You don't eat. And apathy or inertia. That means you are very inactive, lethargic, and then this remain dormant, just without moving much. There are thermoregulatory mechanisms. There are some ones are reflexes and some ones are semi-reflexes. Autonomic, somatic, endocrine and behavioral things are there. So reflex responses include, they happen through the hypothalamus. It's the anterior hypothalamus. It's activated by the vermouth, and then stimulation causes cutaneous vasodilatation and sweating, and so that is there to lose the heat. So lesions in the anterior hypothalamus causes hyperthermia because the heat loss is reduced. Posterior hypothalamus is activated by the cold, so that you get shivering. So in the lesions of posterior hypothalamus, the body temperature reduces. So afferent to the thermoregulation threshold, for the cold, temperature sensors of the skin and deep tissues and spinal cord and hypothalamus, they send the afferents. Afferents means they send the sensations of coldness to the skin, to the brain or to the hypothalamus. And thresholds are the 37 degrees Celsius for the sweating and vasodilatation, and 36.8 for the vasoconstriction, and 36 for the shivering and thermogenesis, and 35.5 for the shivering. you can see some example, so that if the body or the skin temperature decreases, you can see that 37 is marked, so that it has decreased to a slightly lower temperature. So the impulses come to the hypothalamus. So hypothalamus does, it sends impulses to two directions. One thing is to, you can see the vasoconstriction occurs in the skin blood vessels. So the heat loss from the skin will be reduced, so that it will help to increase the body temperature. And the skeletal muscles will be activated, so it will cause shivering, and then that increase the metabolism, and it will increase the heat production in the body, so that again the body temperature will be increased. If the opposite happens, now the body temperature has increased than the 37 or the normal temperature, so the impulses come to the hypothalamus, so that it will cause cutaneous vasodilatation. You start to sweat, and the sweat glands become more active, and then so because of these two, now through the skin directly heat will be lost, and by the sweating also evaporation and radiation, both mechanisms will be activated, and heat will be lost from the body. So that there are thermoreceptors in the skin and the hypothalamus also. So thermoreceptors in the skin will detect the external temperature, and the thermoreceptors in the hypothalamus will detect the blood temperature. So the thermoregulatory center in the hypothalamus will send impulses to smooth muscles in the arterioles to vasodilatation and vasoconstriction, and it will send impulses to sweat gland to sweat, erectopyly muscles in the skin to the skin hair to stand up. The skeletal muscles will be stimulated to shivering. Adrenal and thyroid glands to increase the adrenaline secretion and the thyroxine secretion, by doing so to increase the metabolic rate. So this is another image, another figure that is taken from another book. So this, you can see the neural factors affecting thermoregulation. You can get central chemoreceptors as in the hypothalamus, and the peripheral chemoreceptors on the skin. They stimulate the hypothalamus. So the sympathetic nervous system and somatic nervous system both will send the efferent discharges. Sympathetic nervous system will cause cholinergic. It will act on the sweat glands to heat loss by evaporation. It will send impulse to the adrenergic through the adrenergic nerve endings to vasoconstriction. And beta adrenergic, so that it will cause increased metabolism in the fat brown adipose tissues. It will again produce heat. And somatic nervous system, cholinergic nerves, it will cause the shivering of the by increased action of skeletal muscles. It will cause heat production by shivering. Okay, then we come to the fever. So the body temperature above the normal range due to abnormalities in the brain or toxic substances acting on the thermoregulatory center. So that is the increased body temperature. And there are pyrogens. Pyrogens are some chemicals that stimulate to produce fever in the body. So So the normal body temperature is regulated by the hypothalamus. There are deep hypothalamic centers. There is a set point. The body hypothalamus is keeping the temperature at a certain level. There are peripheral thermosensors are there in the skin, and then it will, they send the, as we discussed it previously, they give the afferent fibers to the hypothalamus. From there, efferent nerve fibers come to the sweat gland and blood vessels to increase the heat loss, and they will send impulses to the skeletal muscles to heat production, and there will be a balance, because if you want to increase the heat loss, cutaneous blood vessels will be dilated and the sweating also will increase. And if you want to reduce the heat loss, sweat glands will be inactive and the cutaneous vessels will be constricted, so the heat loss will be reduced. And in addition to that, the skeletal muscles will go into shivering or continuous contractions, causing increased heat production. So that hypothalamic thermostatic set point is there, so that if you get fever, there will be a release of prostaglandin E2. It's a fever producing cytokines, and they are released from the inflammatory cells. For example, if you have got some shall we say infection in one limb, and then it will produce this some pyrogens such as prostaglandin E2, or there can be some other cytokines, so that they will be traveling in the blood, they will be added to blood, and they will reset the thermostatic set point at the hypothalamus. So once they are reset, the body will start to, the hypothalamus will start to reset because you know that at this point the hypothalamus is set to the temperature of 37 degrees, but it will be reset to another higher level. Shall we say, if it is reset to 39 degrees, the temperature, the body will have to increase the temperature, because so it will cause cutaneous vasoconstriction and shivering, and this increase the metabolism, and then it will produce more energy and it will reduce the low loss also, and the body temperature will increase. So you feel like you get fever. If you by using the thermometer, you will feel cold. I mean, if you, without the patient will feel cold, because the patient's hypothalamus is set to a higher level, so that patient will feel cold. But if you touch from the outside, you will find that the patient's body is hot, and then if you use thermometer also, you find that it is hot. Then by increasing the heat production, the core body temperature will come to the reset level. So that if you want to, if you are going to decrease it, but again there are a lot of heat reducing responses like vasodilatation, sweating, and increased ventilation. They will help to reduce the temperature also. Pyrogens. What are pyrogens? Pyrogens are substances, they elevate the set point of the thermoregulatory center. So they can be breakdown products of bacteria. For example, lipopolysaccharide toxins, cytokines like interleukin I beta, interleukin 6, IFN beta, INF gamma, INF alpha. They will cause formation of they will reset the hypothalamic thermoregulatory center, and prostaglandins also. Prostaglandin E2 is a pyrogen. So there are some antipyrotics also. Antipyrotics means something like things like paracetamol and not paracetamol actually, exactly the aspirin-like substances. They will produce the inhibition of prostaglandin synthesis. So tumor cells also, they produce inflammatory cytokines, and then or necrotic tissues. If there is a tissue death, they also produce inflammatory cytokines, and interleukin 1, 6, interleukin 10, TNF alpha, interferon, and they act on the liver and they reduce the C-reactive protein, they increase the C-reactive protein production. And these factors, these pyrogens will increase the production of prostaglandin E2. Necrotic factor tissues also will increase the prostaglandin E2, and they will act on the hypothalamus, and then it will produce the fever. Fever is it's a temperature rising mechanism, and then there are two main mechanisms to rise the temperature: by producing more heat. One example is by shivering, or reducing the heat loss by the vasoconstriction. So is this fever beneficial? Yes, the fever is beneficial because the rise in the body temperature inhibits the growth of bacteria, and it will increase the antibody production, so that hypothermia slows down the growth of some tumors. So the production of the causation of fever is it's an immune mechanism, so that that whenever somebody gets a fever, you don't have to take paracetamol, right? Sometimes, usually we also tell the because mothers just when they feel that baby is little bit warm in the body, they come to doctors, and doctors asking that the child has got asking for medicine, telling that the child has got fever, and sometimes they just touch the head and neck and abdomen and various places, and they say the child has got fever. But usually it's not maybe just 0.5 degree increase. If the child is comfortable, usually if the child, or even if it is you, even if you have got fever, if you are comfortable, if there is no other, if you don't feel any pain or any muscle pain or any difficulty because of the fever, you may tolerate it without taking any antipyretics. Sometimes because you have to get the benefit of fever. Because sometimes when the patients come to the doctors, if the patients say that I have got I or my child has got fever, the doctors give paracetamol for 6 hours. It is not necessary. What we do is that usually what you have to do is that you give some paracetamol, and you can say that if you get fever, you take it. But again, you say that if you are comfortable, the child is eating well, and if the child is playing well and doing things happening okay, if the child is happy, just let him be there like that. The only problem with fever itself is that some children go into this febrile convulsions. But if the child is not getting febrile convulsions, it's okay. You can leave him with a slight increase in fever, right? It doesn't matter. because fever itself does not kill anyone, right? So somebody, you will be killed by masking the cause for fever. For example, if you have got some massive infection in the body, and if you reduce the fever by just without looking for the reason, and then it can aggravate the condition and it can kill the patient. So that just you have to keep in the mind, even when you get fever, if you do not feel any difficulty, just wait. And if you find headache and difficulty, and you can take paracetamol, of course, because you don't have to suffer. Unwanted suffering is not necessary. But otherwise, if you do not feel anything, if somebody says that if your this roommate or if your boyfriend or girlfriend say that you are warmer, just if your mother or father say that you are warmer, and even if you don't feel that, just ignore it. You can wait, right? You don't have to take this, you don't have to reduce the fever always, right? Sometimes you can wait without reducing the fever. I mean, just within a certain small increase in the body temperature does not make a problem, right? If it is, of course, if it goes to maybe 2-3 degrees Celsius higher, then you have to do something. Otherwise, just 0.5 degree or 1 degree Celsius increase or decrease in the temperature, you don't have to worry. Okay, right, thank you.